Imagine this scenario. The health issue you have been postponing for several months suddenly becomes an emergency, and you need to have surgery now. You paid for a consultation with your doctor only to hear what you already knew you had to do: operate on that knee, spine, organ, etc. This surgery is scheduled for 2 to 6 months from now, and even though it gives you some time to save up, it remains a significant expense. Even if you dip into your savings, you know you won't fully cover all the costs that will arise. Eventually, you will have to cancel all your scheduled commitments. Call your workplace to let them know you'll be absent for the next few days. A lot of worries will fill your mind. You simply have no other choice but to follow the instructions given to you by your doctor. What if I told you that you don't have to go through any of that? You can even schedule the day of your surgery, choose the hospital, and more than that, you'll have the opportunity to save a lot of money if you have the procedure done outside your country.
Right now, you probably have even more questions. How could that be? Why would it be cheaper for me to have surgery abroad than in my own city? What about the travel arrangements and the recovery time? In the next few minutes, I will tell you everything you need to know to have surgery abroad. But first, let me tell you a little bit about it. My name is Natalia Arregui, and I am part of the team at Go Health, a company dedicated to medical tourism. If you haven't heard this term before, let me take a moment to explain it to you. Travel agencies plan dream vacations from other people waiting for a family. In the same way, Go Health works to plan your trip in the medical sector, an agency that has a wide network of doctors from various specialties, allowing you to easily find a specialist you need to address your situation. An agency that has contacts with the best equipped hospitals to carry out any type of surgery or intervention.
And now the big question you may still have: why abroad? As I mentioned earlier, the main benefit to receiving surgery outside your home country is the great reduction in cost. And as we are located in Guadalajara, Mexico, you will end up spending less to have surgery here in Guadalajara rather than at home, as well as be able to get back to your life faster than if you waited for surgery in your home country. By the end of this video, you will realize how easy it really is, and you will be able to schedule your first consultation with our doctors from your home. Just like the case of Dan Kerr, a 60-year-old patient who suffered from benign prostatic hyperplasia, one of the most common benign neoplasms. It affects 15 million men in the United States, and in the year 2000 accounted for $1.1 billion in healthcare costs. When Dan was diagnosed, he had 3 options. 1. He could follow a medication-based treatment that would take up to 2 years for recovery, without any guarantee of the outcome. 2. He could undergo surgery as a definitive treatment, but would have to wait an average of 6 months to a year for the surgery. However, during this waiting time, he would need to use a catheter connected to his bladder, which would be the only way he could urinate, resulting in an extremely uncomfortable situation that would greatly affect his quality of life. Or 3. He could look for a private hospital on his own, where the cost would be higher due to the privatized care. Undoubtedly, for Dan, the idea of using a permanent urinary catheter caused him to experience significant emotional distress, as he thought about how drastically his life would change. The idea of having to use a urinary catheter overwhelmed him, which is why he started searching online, where he found testimonials from other men going through the same situation. They shared their experiences and recommendations for continuing with their daily routines while using a catheter. Through this, he realized that this complication is so common in men of his age that surgery becomes inevitable. The surgery itself is very simple and minimally invasive. However, the waiting time for surgery through his healthcare system was extensive, and the costs were excessively high if done privately. He started searching online, reading forums and testimonials from other men in similar situations, realizing how common this condition was and how long the waiting lists could be. After browsing several online communities and forums, he came across an advertisement from our company, Go Health, offering assistance for international patients seeking surgery in Mexico. He filled out a short form with his information, and soon after we contacted him through a video call to learn about his case and help him find the fastest, safest solution. We assured him that from this moment on, we would take care of his case and accompany him throughout his health process. From that moment, his health was in our hands, and we began to explain the 7 steps through which Go Health assists its patients. 1. The first step, which he was already fulfilling, was the phone appointment for the evaluation of his condition with one of the Go Health team members. A face-to-face call with a certified doctor who, through an initial assessment, would refer him to the appropriate specialist. 2. Consultation with the specialist and surgery scheduling. After the call, our specialist would schedule with the hospital to define the date and time of his surgery or intervention and begin the quotation process for his health journey. 3. Preparing for surgery. Once the surgery is scheduled, the Go Health coordinator would stay in constant communication with him to inform him about the planned schedule, laboratory tests, accommodation, and other travel details. This way, he would be informed of all updates regarding his journey and stay in Guadalajara. 4. Arrival in Guadalajara, Mexico. From the moment he arrives at Guadalajara International Airport, Go Health personnel would be waiting to receive him and take him to the hotel where he would stay. 5. Surgery. On the day of his surgery, the Go Health medical coordinator would accompany him to handle all hospital administrative procedures, facilitating his process to ensure he feels calm and prepared for the surgical intervention. 6. Discharge and recovery. Upon discharge from the hospital, our medical coordinator would support him to facilitate his hospital departure process. During the recovery process at his hotel, we would assist him at all times until the treating physician evaluates his possible return home. 7. Return home and follow-up. When the treating physician indicates he can return home, our medical coordinator would accompany him back to the airport. After his departure, the Go Health team would contact him to schedule a remote session to follow up on his recovery and address any questions or concerns.
And just like that case, we have a dozen more cases of patients who eagerly share the experience upon returning home fully recovered. Unfortunately, we don't have enough time to talk about all of them in this video, but you can view them on our website in the section below. What we want you to know before we finish is that as just they have their doubts about traveling to our country for surgery, you probably have yours too. We understand that leaving your home for surgery can be uncomfortable, so we want you to address your concerns by answering a few questions that previous patients have asked us. My name is Daniel Rivera and I am part of the team of Go Health. How safe it is? You will have our support 24/7 throughout your stay. From the moment you arrive at Guadalajara's airport until your return. You won't have to navigate the city alone if you don't want it. Though the hospital has the necessary infrastructure, like in that case, the hospital where he was treated is among the top 10 hospitals in the country and ranks among the top 7 globally according to the World Best Hospitals 2022 list, as well as the other 6 hospitals that we have on our list. How expensive it is? Just to give you an idea, a simple surgery like the one Dan underwent in a private hospital in the USA costs an average of $20,318 US, including hospital charges and medical fees. But here in Guadalajara, the average cost from the same surgery is equivalent to $10,000 American dollars.
Before the conclusion of this video, you will find a link below that will take you to the same form Dan used to enter his contact information. In a short while, you will receive a response from us to begin your health journey. Normally, a medical consultation with a specialist costs between $100 and $300 US. However, for this occasion, you will have the opportunity to schedule a consultation with us completely free of charge. Simply leave your information by clicking the link below this video, and one of our medical coordinators will contact you to schedule your first assessment appointment. During this call, you will be able to clear up all your doubts regarding your condition's treatment and receive all the information you need to understand the process you will follow if you decide to undergo surgery in our city of Guadalajara. Remember, you could be just minutes away from knowing when you'll be able to return home fully recovered and resume your daily activities as they were before your condition. Don't delay your treatment or the surgery you need to undergo. Contact us to be attended to by one of our specialists today. Once you provide us with your contact information, you won't have to navigate the process alone. Remember, you're just a click away from finding the solution to your condition and regaining your well-being and peace of mind.